first slide, Jeff. It continues to be a very trying time here at us. 49 represents the number of people who have passed away since August 9th when, at least that's kind of where I think our fourth wave started to get real serious. So these deaths are happening from patients who are young and old, male and female. Some are, coming in with some compromising issues. Some are coming in previously very healthy. Overall, the trend line, if people watch those, is stabilizing a bit. We don't know if that is reason for optimism. We'll take it at this point, but it's yet to be seen. But what it is still revealing is there is one common denominator. It is the unvaccinated population that is driving our inpatient care. It's costly. It's delaying care for other non-COVID things, ability to accept transfers, and that's all very well documented in national and local reporting. So in the following slides, here's what we're dealing with right now at Bryan. At midnight, we had 71 patients hospitalized for COVID-19, and as you can see, only 10 of them were vaccinated. When you go to the ICU levels of care and patients on ventilators, this has been a constant for, several weeks running that the patients in our ICU and on ventilators are all unvaccinated. You can see it spanning the ages. It's got a nice little traditional bar chart there. Dr. Nora might be able to elaborate on this, but the older patients is where we're seeing some vaccination breakthroughs requiring hospitalization yet. But you can see there are some very young people in there, and heck, when you're my age, if you're in that middle bar of 50 to 64, I still consider that young. And then it was kind of alluded to on the opening slide. On patients on ventilators, they are exclusively unvaccinated at this point, and you can see we have, by my criteria, all very young patients struggling with this. We remain very full. At midnight, we had 552 patients here at Bryan Medical Center receiving some level of care. And I think where the weariness and frustration lies is that at a hospital like ours, we're the last line of defense in this pandemic. With that, we are so thankful for the people in Lancaster County who have gotten vaccinated at higher rates and adhering to the different layered protections, like beyond the vaccination, some distancing and masking that's in place here. And I think we'd be in a pretty crippling situation if we did not have the cooperation from the residents of Lancaster County. So a big thank you to all of you. And where this is really important, when you're looking at our COVID inpatient numbers, 38% are now from outside of Lancaster County. You put that all together, and the vaccination rates here in Lancaster County are so helpful for us. One last thing. I say all that, there's still some room for improvement. If you have not yet got the COVID-19 vaccine, it's very easy to do. It remains free. You can text your zip code to that. You can call that number. Or you can go to vaccines.gov and find out where you can get your vaccination. Before we turn to some information on monoclonals,